Here. All right, so welcome to this quarter's Direct Care Workforce Collaborative. We're so happy to have you here. Like I said, I see some familiar faces, also some new faces. And so shortly I'll find out how you heard about us and got here today, which is great. But so this month we have just a lot of updates coming out of the department and to share some resources, which we're really excited about. So moving into the first couple of slides. This is just a quick overview of the agenda today. So we're going to start out with just some attendance and some polls, just to get an idea of who's joining us today and where you're coming from. We'll meet the team shortly, which is our leadership team, along with our co-chairs, and then the HICPUF Direct Care Workforce Unit team. We have some ARPA updates coming out of our department, as well as hearing from a couple of the vendors who are working on those ARPA projects. We'll have some time for Q&A after that as well. We have a new agenda item that's going to kind of be a stand-in for the next several meetings, which is opportunities for direct care workers. And so those are opportunities specific to our direct care workforce that we can share with them specifically during that time. In addition, we have some updates on the proclamation, Direct Care Workforce Appreciation Week, that'll be happening in April. Some open forums, so if you have resources or announcements to share, we'll be doing that, and then we'll go through our closing. So full agenda today, hopefully some good conversation and some good updates for you. So you probably received the update that we are recording. We will post the recordings along with the slideshow to our website, the Direct Care Workforce Collaborative website, which someone from my team will drop into the chat shortly, and you'll see it throughout the meeting as well. We'll continually kind of share that. Use the chat for questions. Our team is here to monitor the chat. You can also raise your hand. I'll keep an eye on that throughout. Well, this is a really open feedback kind of forum, and so we encourage questions through the chat or through raising your hand. So we're happy to have those. Like I said, we'll post the slides along with the recording after the meeting to our website. Those usually go up within, that should be up by the end of the week, I would assume. We have to do some accessibility stuff to make sure all the links are active. So sometimes that can take a day or two, but definitely check the website and send folks there that maybe weren't able to attend live today. If you're listening by phone, welcome. You are welcome to press *6 to unmute your line at any time, or *9 to raise your hand. I have turned on closed captioning, so you'll be able to see that. If you don't see that and you'd like to, on your black toolbar, there is a place to turn on closed captioning. And again, our meeting information will be posted to our website. All right. So I just want to do some quick attendance. So if you wouldn't mind, if you're here today, if you wouldn't mind putting your name and how you are connected to direct care workforce in the chat. So whether you're an employer, provider, if you're a direct care worker yourself, and your agency or organization, you can pop that in the chat just to see who's here today. And then we'll also do some polls to see regionally where we're at. If you're on the phone and you'd like to report in for attendance, again, you're welcome to press *6 to unmute your line or *9 to raise your hand. So I'll be checking that as well. So it looks like we have 64 participants, so I'm going to go ahead and run the polls here so we can see who's with us, and folks will get access to them as they come in as well. So the first poll is going to be, what region do you represent? And so this is where you live, because we know a lot of folks may live in a different county and travel to another county to work. But for this specific question, we would like to know where you're located, where your residence is. So we'll give folks a few minutes here. All right, that looks like about everyone's had a chance to answer that. So I'm going to go ahead and end the poll and share the results. So a lot of representation from Region 1. which is typical of what we see in our action group meetings. We do have some representation from the other regions as well. If you know any folks down in that Southwest region, the Dolores, La Plata, Montezuma, San Juan County, that's Durango, Cortez, that area, and you want to share this with them, we would love to do that. We'll also plan on doing some targeted outreach down there. We have connected with the Centers for Independent Living down there, but certainly want to do a little bit more targeted outreach to get folks from that area joining us. So the next poll we're going to have is how you identify on the direct care continuum. And I'll give folks about a minute here as well. All right, so let me share these results here. So we have a handful of direct care workers here, as well as some individuals receiving services and family members, so welcome. Lots of employers, advocates, and of course our government agencies are always well represented as well. So please specify in chat if you're willing to share. You probably already have as part of your attendance, so thank you for that. And then last but not least, we always like to find out how you heard about us. And so this is just a real quick poll question to see what's working best to connect you. All right, so HCPF newsletter communication, we see that typically in our action groups as well. That's a really important way for folks to get information on not just these meetings, but also our other stakeholder engagement meetings. So if you haven't connected with that, we call it John Barry's newsletter. Please let us know in the chat, and certainly we can get you connected with that. And then obviously thank you to our employers and other providers, advocacy agencies, always sharing the message as well on these meetings. So those are all the polls that I have. So we're going to go ahead and move forward. So meet the team and purpose and vision. And so we do have Penny here today, but unfortunately she's under the weather. So we just appreciate her for being here. But I'm going to go ahead and take us through the introductions. I'm going to do a call out really quickly and see if our new co-chair, Oliver, is here. I don't see him on the list, but just in case I'm missing him, Oliver, are you here? Okay, perfect. He must be having connection issues. So I'll just go ahead and take us through this. And if he pops in at some point, I'll make sure you get a chance to meet him. All right, so this is not Penny Whitney and Oliver Giminero. This is Brooke Snyder. But we just want to welcome you to the Direct Care Workforce Collaborative. This was updated in August of 2022 with our Direct Care Workforce Collaborative leadership team. Those are the co-chairs that you see on those action groups, as well as members from the HCPF team. And we kind of sent this out to the action groups in fall of last year and said, let's revamp it. You know, we've been around for 2-3 years now. Things have changed a little bit. So let's revamp this purpose and vision. So where we landed is the purpose of the collaborative is dedicated to advancing the public's general awareness of the workforce and advocating for improving compensation, benefits, training and career advancement, and recognizing the value of direct care workforce in all healthcare sectors, and identifying, you know, that the direct care workforce is part of the healthcare continuum as well. The vision is, you know, envisioning consumers receiving the high quality support from a strong and skilled workforce. They're well compensated, they're well trained, they're well respected. You know, we want them to have opportunities for advancement, highly sought after jobs, and really that recruitment and retention. And I'm not sure why I stopped sharing. So let me get that back up here for us. There we go. All right. Technical difficulties, I guess. So let me get us back going here. All right, so you'll see that the purpose and vision is directly tied to the action groups that we have. And so if you're interested in learning more about the action groups and going to those meetings. We'll have the link later on to sign up for those. You can also find the schedule on the Direct Care Workforce Collaborative website with the Zoom links on it. You don't have to sign up before you attend. You can come try them out for a few minutes or stay the whole time. You can drop in, drop out, whatever you like, just to make sure that's a good fit. We welcome anybody in those meetings. So, all right. So these are our leadership teams. I'm going to do one more quick look for Oliver here just to make sure. I don't want to skip him. So Penny, most of you, if you've been around the collaborative, have met Penny, our long-term care consultant and collaborative for a long time, our solo co-chair. And she's just done a wonderful job. We're so grateful for her. But now she has another co-chair. We welcomed Oliver Giminero to the Direct Care Workforce Collaborative in January. And so if you've been to action group meetings, you probably know him. You may also know him for other work in this space. He's a big advocate. He's on a lot of boards and a lot of agencies, and he's just really well connected. He is a consumer, and so he brings that perspective for us, and also brings a nice connection to the self-direction piece as well. So with that, our action group co-chairs, I know that Hope is here. I believe Pascal is here. We welcome them. They are the co-chairs of our value and awareness action group. Deborah Lively is our solo co-chair right now for compensation and benefits, and we are actively recruiting for another co-chair for compensation and benefits with Deborah. So if you're interested in that, please let us know. We would love to have a strong co-chair for Deborah to continue moving forward with that action group. And then Joseph and Chrissy are our action group members of training and career advancement. Joseph is fairly new, so if you haven't been to a meeting in the last couple of months, he joined us in December, I believe. Super excited to have him from Thrive Skilled Pediatric Care, so he brings another element as well for us. And then last but not least is our HICPUF workforce team, and that includes Candace, the division director, Heather, our supervisor, and then myself, Sam Hall, Jennifer Blair, and John Hendricks. Well, you will hear from all of us over the next little bit on the ARPA projects as well. So quick and dirty, but that is our leadership team. So with that, let's move right into ARPA updates and question and answer. So we will take questions throughout the presentation. I'll be monitoring the chat, but we all have time for Q&A at the end as well in case something gets missed. So feel free to pop in whenever you would like. So first off, Jennifer, if you are here, I would love for you to introduce yourself briefly and take us through these first few slides.
Thank you, Brooke. My name is Jennifer Blair. I am the Data Infrastructure Specialist here on the Direct Care Workforce team here at HICPUF. And I'll kick off the American Rescue Plan Act updates that our team will be going through with each of the projects that we're kind of leading. The first one I'm going to be speaking to you about is Initiative 1.02. It consists of a couple surveys. And the first one I'm going to talk about is for the direct care workers in Colorado. This survey was to collect data on their job satisfaction level. So the survey was open this past December and January for about 8 weeks. And so we're still putting together the results to formally share with you guys. But here are some of the highlights that we have. It was very exciting to have 756 completed surveys and 51 counties represented. And overall, it seems like the direct care worker is satisfied or very satisfied working this job. But then as you see, the salary and wages and training aren't as highly satisfied, which is probably not any news to anyone, but it's great to have some very recent numbers to put to this. And then the least satisfied aspect of their job or benefits at about 45%. So it's a lot of work that we can work toward, and we are pushing out a second survey this year. So we're going to be going back to the drawing board with tweaking some of the questions to make sure we capture what we intend to, and hopefully get all those 64 counties represented. So please look out for us kind of to outreach to all direct care workers. If you know any, please reach out to us as we gear up for that second survey, but very exciting to be sharing this data with you in the next coming month. And then the second part of Initiative 1.2 is the staff stability survey. And you could go to the next slide, Brooke. And this is for HICPOF partnered with Advancing States this past year to participate in a pilot survey. And this project was to create a reliable tool to capture state and national level data regarding stability and quality of the workforce supporting older adults and people with physical disabilities. If you know, Advancing States publishes quite a bit of reports with national core indicators, as well with Human Services Research Institute. So in the pilot last year, Colorado had 447 agencies that were eligible to participate, with 123 elected to participate. So listed here are a lot of the categories of the questions that we surveyed. And a lot of the information is not surprising, but like I said, it's numbers that are really recent that we could use. So just some quick highlights. Primarily, the direct care worker in Colorado is female. They are primarily white, second to African American and Latino pretty evenly. About 71% of the respondents provide in-home support, 33% of the respondents provide residential support, and then 15% provide non-residential support. So that's good to keep in mind as you see these numbers come in. Turnover rates came up to almost 47%. So as you guys are living this every day, hopefully that really represents what you guys are feeling. Something definitely we need to work on. Good news, about 52% of the agencies provided between 21% and 40% above the state's minimum wage. So again, great to see. A lot of work that we can do. The survey came back showing about 57% of this workforce is part-time. So that definitely brings its challenges with that. But hopefully these numbers will kind of gear us toward, we have a second survey for this one coming out this year, and it's going to be a full survey, and hopefully more states will be participating with that. So we have a little bit more comparative data with national level statistics to compare to. But from these results, we really want to push for better decisions for the workforce initiatives, such as the other ARPA projects, government partnerships like the other states that might be participating in the survey, context for outcomes data, baseline for future analysis, projections for budget, policy planning, stakeholder engagement, and quality assurance. So just a reminder that we love the participation that is going on with these surveys, and really wanted to share some of the results with you, but look forward to some formal reports coming out soon. And it's just very exciting to share this. So yeah, we'll be working on some outreach for those second surveys coming up. And I'll shoot it back to you, Brooke, for the next update. Thank you.
Yes, actually, Jennifer, we did have a question come in
Sure.
too, that is just wondering if we can define who or which occupations are included in the direct care worker category, or who's eligible to take that survey.
Sure. So we tried to intend this survey to anyone that is receiving pay that's providing direct care. So a lot of that roles came with different titles. And so it's great to be clear with this next survey coming out who it's intended for. But it is a very large range, and there are some gray areas of who truly provides direct care. But hopefully that answers your question of the direct care worker versus the staff stability survey. We really wanted to capture the whole workforce with both these surveys.
All right, and then it looks like Elizabeth has a question, then Nancy, I'll grab you as well. Elizabeth wants to know, where do we access the survey stats that you were quoting there? Is there a place to find those? Thank you.
Officially, there is not from the staff stability because they have not yet come out with the report, but we just wanted to verbally share a lot of this with you guys today. But hopefully, usually with Advancing States and the national data, it usually takes about a year, unfortunately, to come out because this pilot is comparative to the previous year. However, with the direct care worker survey, we're still compiling it, and we'll hopefully be sharing that this summer publicly. But please reach out to the workforce team if you'd like a more specific update, or if you'd like to just keep in touch with me. I'd love to keep you guys definitely in the loop for as early as that's possible for you guys to have access to.
Perfect. Thank you, Jennifer. Yeah, so we will provide updates continually through this collaborative as well as the action groups. And then like Jennifer said, if you just would like to reach out to the workforce team, we can let you know kind of timelines on that and when to expect it. So Nancy, please.
So the question about the job titles was mine. And so Jennifer, I can appreciate that there's maybe a lot of job titles being used in the industry, but can you actually help to clarify, are we talking about CNAs? Are we talking about home health care? We're talking about home care. Are there,
Correct.
And I'm guessing it's not nursing staff, correct?
Correct. Yes.
So anything prior to nursing staff level credentials and training and all of that.
Perfect way to think of that. Yeah, CNAs are definitely welcome. We tried to outreach to a lot of them, but we definitely welcome being able to reach more CNAs. And I guess it's difficult because a lot of CNAs might be working their way up to nursing. So while they take that survey, hopefully they have that title of a CNA, but we definitely consider that part of the direct care workforce population. And so I think that's important to put that in the survey.
And those are kind of the medical side, but perhaps more, I think you had mentioned that these are folks working with individuals with disabilities as well. So it may also be like, I'm trying to think, because I've been working with an organization that provides like occupational and
Sure.
support to individuals with disabilities. And so,
Yes.
and I can't think what those jobs are called, but we're talking both medical.
Yeah, the medical side, like you
non-medical.
mentioned. Yeah, and then someone that just might be a homemaker, providing aid. I'm sorry, I'm trying to blank too with the titles because there's a lot. But I could just pull up the survey real fast with some of the titles. We had like a direct care worker, home caregiver, in-home caregiver, home health aide, certified nursing aide, direct care professional, elder caregiver, certified home health aide, direct care staff, in-home health. But like you said, like LPNs, maybe not, nursing staff, that's considered a different population. But if they do provide direct care in-home support, then it might be an overlap with their job. And so that's definitely something to consider that would be representative of this population. So does that help answer your question, Nancy?
It does. Thank you.
Yeah, of course.
Perfect. And Jennifer, maybe what we'll do is, I know that you shared in one of the other action group meetings, all the different titles that we had, well, not all of them, but a handful of the different titles. Maybe we'll throw a slide in here too, so folks can go back and see all the different ones that we saw.
Yeah, that's actually a great idea, especially to gear up for that second survey, to just make sure we capture everyone, because it's very exciting to see the response for this first one, but there's more people out there. So
perfect. Thank you very much, Jennifer. All right, let me move us on here. I believe we have Dr. Judy Scott here to give us just a quick update on the standardized core curriculum. This is ARPA Project 1.03. Judy, are you with us?
I'm right here.
Lovely. Please.
Hi. How are you all today? Thank you for being here. I really appreciated hearing that data, Jennifer. It's very interesting that 75% or so are really satisfied with their training. We've been working on the standardized core curriculum now for some time. We have a robust outline developed that will cover what would be, according to the standards in Chapter 26 and the regulations, that would be our first 4 courses that are going to be the outdoor curriculum. And then we have an expanded curriculum, or we could call it specialized 2 of modules that will be of interest to help the direct care worker expand on their training and some maybe needs up front. Again, just as a reminder, the standardized core curriculum is not to replace whatever an agency individual is doing for their own training, but to augment and supplement and provide a menu of courses that could be chosen as options. We have on our timeline to finish up the curriculum this spring and start our pilot sites. And on Friday of this week, we have a listening session with some folks who have asked if they can pilot the curriculum with us, and things that we will be working on with them will be what modules and timeline and what method of delivery. So given I've only got a minute or two here, if you have any questions, my contact information is on the slide. We can put it in the chat. We welcome input. We're on our third advisory group meeting tomorrow. So we get great input through our listening sessions, our advisory group, and direct input from you through some small surveys that we're doing that are have been giving us some info. So thanks for your time. And if you have any questions, pop them in the chat and I'm happy to get back to you.
Perfect. Thank you, Judy. We appreciate it. All right. So moving on to the next one, Resource and Job Hub. So John, if you wouldn't mind introducing yourself quickly and giving us just a quick update, that would be great.
Yeah, absolutely. Hello, everyone. My name is John Hendricks. I am working on the Resource and Job Hub. I'm the Direct Care Workforce Support Specialist, and that is Initiative 1.04. For those that might not be familiar with the Job Hub, it's going to be a resource, job search, and employer matching hub for direct care workers. Basically what this is for individuals can go to this website to receive information about resources about direct care positions, access free training, and view job boards to be placed in positions. And once someone is completed a training module, that information will be entered into a database so that person can actually track their certification through multiple jobs. Right now, we have completed the candidate registration process and profiles, the resource library and filters and search functionality on the website. The credentialing system is done. The collaboration or discussion forum has been completed, and the learning management system for the courses and modules has been completed as well. So we're more than 50% done right now. Just actually yesterday, we got access to the testing environment. So over the next 6 to 8 weeks, we're going to spend about an hour or two a day testing the site for any bugs. And that will go until mid to late May. And once that has been completed and the bugs have been figured out and ironed out, launch for this website is estimated the end of June.
Perfect. Thank you, John. Couldn't find my mute button there. All right.
No worries.
Perfect. So I don't see any questions in the chat, but again, we'll have a little bit of time at the end too if things pop up in regards to any of these projects. So next we have Heather Johnson with the 1.05 provider grant.
Well, I'll give a real quick update about this because I know there's a lot of providers on here. So if you are an HCBS provider and you would like to have training opportunities for your staff above and beyond the basic onboarding or any sort of annual required training, please consider checking out the provider grant. Awards are up to $100,000. It can be $5,000. We'll consider anything up to $100,000. So we do have 4 cycles left. This current cycle ends the end of this month. So we have awarded 14 grants so far out of our first 2 cycles, and a total of $1,089,715 has been awarded. We have many more millions to go. So please consider checking out the application and the RFA to see if it is something that would work for you. I would like to throw out a couple of the training titles that have been approved in case it sparks any thoughts. Crucial Conversations, we had one agency do a direct care worker mentor pilot program so they could use the money to support the mentor, to develop a mentor program and then support that mentor with it was a mentor wage during that period of time. Collaborative Safety was one of the trainings grants we have awarded. Home care for patients with mental health disorders. Those are just a few, just kind of throwing out some ideas. I think what you would need to keep in mind is it needs to be geared towards the workers actually doing the hands-on work with the members, not so much management. And also just that training that would help them gather higher level skills that would help them in their job, maybe working with different members, different types of members, taking on more members. It could help your agency take on additional members. So just kind of think of it in that scope, and please be prepared to come with questions. On March 16th, we are having an informational webinar. We'll kind of go over the process and then we allow time for questions and answers. And all of our previous webinars are on the website, the recording, so you can also look there. And some of the training is actually, the grants went to training vendors who are preparing this training for the HCBS population. And so we will, for free, so we will be pushing out those, helping these vendors get that word out through John Barry's email. The Constant Contact will also have stuff on our Direct Care Workforce website. We'll probably look at what advocacy organizations might be willing to help share this information, especially if it's for a specific population. So just keep an eye out there. There could be training that you as a direct care worker or your staff as an agency could could be interested in. I will also push the caveat. You can consider in the grant request the wages for the staff to attend the training, because we understand that training is that burden of the provider, and that could be a big hurdle to have people take the training is how are you going to pay them to be in that seat? So please just keep that in mind. And I look forward to reading your grant applications in the future. And I didn't look at the chat, so I'll let Brooke do that.
Yeah, I don't see anything in the chat, but we do have Allie with her hand raised. Allie,
Okay.
please.
Hi, yeah, let me lower my hand. So I just wanted to see if it's okay that I just talk about Vital Hearts briefly, because we are one that received the grant, and just tell everybody a little bit about the training that we'll be providing for direct care workers, if it's appropriate to do so.
I was deferring to Heather, but she's
Yeah,
nodding her
sure.
head. So yes, please.
Oh, okay, very good. Thanks so much, Heather. So my name's Allison. I work for Vital Hearts. We are a nonprofit whose mission is caring for care providers. Our main program is a secondary trauma resiliency training that is a proven and effective response for all the painful personal and emotional costs that so many care providers experience in their work. This burden is a significant factor driving the increase of care providers leaving the field. So our secondary trauma resiliency training does revitalize, and it often saves careers. We're thrilled to be able to offer this training to direct care providers thanks to this grant that we've received from CDHP. The grant scholarship that we're getting will offer full scholarships to these direct care workers to attend our training. And another amazing thing is, part of our grant, we are going to provide $200 as wage compensation to help facilitate the agencies to be able to send their direct care workers to our training. So, you know, we would love to invite you guys all to check out our website, vitalhearts.org. Hopefully soon collaborate with everybody. We are waiting for our work plan to be approved, so we can't accept any participants yet. So as soon as that's done, we would love to collaborate with everybody, have flyers going. So please check us out, and I appreciate the time to say hello to you all.
Awesome. Thank you, Allison. Yes, so we will be working with not just Vital Hearts, but other of the training providers that have been awarded this grant to push out that information. We will certainly welcome them to action group meetings, collaborative meetings. We'll be emailing that out, constant contact, like Heather said. We'll just be pushing that out and working with them as closely as we can to make sure folks are getting access to this. One thing I wanted to mention on the website, the ARPA grants website that Sam dropped in the chat from our team, is you kind of have to scroll down. So that website is all of the open grant solicitations right now. And so you'll see 1.05, I think, individual grant at the very top. And that is something we're going to talk about a little later in the opportunities for direct care workers. But if you scroll down, I think and they're not in order either. So it's like 1.05, 307, and then again 1.05. So this is the 1.05 provider grant that you'll find on that page. So certainly if you have questions, let the workforce team know through that email and we can get you pointed in the right direction. All right, so we are actually going to go back to Jennifer. She's very busy and she's working on another project. So just another update from her, Jennifer.
Hello again. This update is for Initiative 1.09 Workforce Compensation Research. This is very exciting because it's one of the first projects that we might be concluding soon, or we are concluding soon. The contractor, Government Performance Solutions, is finalizing the 2 reports that are focusing on innovative compensation recommendations. And the 2 reports are for both the direct care workforce as well as the case management side of the workforce. And some of the highlights are listed here that you'll be seeing in the report. So it's very exciting to see that they conducted some intense research, looking at different states, seeing what's working, what's not working, and hopefully we could really incorporate that in the practices going in Colorado, and possibly some partnerships with other states for these programs that might be working. So please look forward to these reports coming out probably later this summer, publicly available for you all to utilize as well. So again, you guys may have questions now about it, but if something comes up later, feel free to reach out, especially if you're curious about when it's available to you, as well as they kind of turn it in this spring, this late spring formally. So I do see Allison's hand is raised. Do you have a question?
I think it's left over from the last one, but Allison, please let us know if not. And I do want to point out too that let's see, someone had asked in there if they could be added to like the Vital Hearts updates when that training is available. And Tammy did put her contact information to get connected with that in there. So, and also, Jennifer, we have a question from Karen Brown. Will the compensation reports have policy recommendations included?
That's a good question. They might briefly touch on some policy, but I think a lot of this information could be utilized in discussion toward policy making, and to have a formal report is important, I think, if you want to bring it to legislation or to really make some actionable steps, to have this formal report to provide that information. So if it's not highlighted in a certain section, then we could probably use it for some policy making, if that makes sense. But we could discuss further offline too, once the reports come out, and see specifically what direction we want to go with and see if it's helpful for that.
Definitely. Thank you, Jennifer. And Karen, we do, the Compensation and Benefits Action Group has been really active in 1.09. In fact, they've done a couple work groups with the vendors as well. And so I certainly think that once the report is out, that group will be kind of responsible for determining kind of the steps forward and seeing kind of what actions are available within the parameters of the action group to take it forward. But certainly a good place to get started, I think. So, all right. Thank you, Jennifer. All right, let's see. So this one's mine, so you're going to have me talk for just a little bit more again. So one ARPA project that we maybe haven't talked as much about is 110 Rural Sustainability and Investment. And so this is kind of a more holistic approach to HCBS workforce, HCBS services in general, and not targeted just specifically at workforce, though it does include it. So this initiative works on 3 separate phases. The first phase is the one we're in currently, which is we are developing a GIS heat mapping tool to identify where services are both offered and accessed across the state of Colorado. The goal of that is to identify care deserts, both in our rural areas and in our inner city areas. Now, I know I'm preaching to the choir here when I say you can tell me that Cortez, Colorado is going to be in a care desert. Even more removed than that, Mancos, Nucla, those kind of areas are definitely going to show up. But this tool will allow us to not only track those care deserts, but then start identifying as things change, but also lead to recommendations on geographic modifiers, looking at someone's geographic location to say, hey, we need to look at a cost analysis and a rate adjustment perhaps. And so we're developing the tool currently. We're going to have some listening sessions in the fall and winter of this year once the heat map is developed. And then we're going to have some final recommendations from the vendor, which are going to include those geographic modifiers or recommendations for those or how to move forward with those, but also on shared resources in rural areas. So looking at how to share the overhead costs, being able to maybe even share staff, which sounds crazy in some areas, but like thinking about, you know, if I can only work part-time at the local clinic, maybe I can pick up part-time hours working as a home care aide or something. So learning how to share resources in these small areas and really just leaning into what you have and learning how to make them more robust. So we're looking forward to those final recommendations, and we'll certainly be sharing when those listening sessions are. We're really trying to hit on those rural areas. So if you know folks in those areas that are struggling or have really good ideas on things that are working for them, we know that some of our rural communities are very strong in what they're doing and have really just kind of made the most out of what they have. So we want to hear both sides of that, what's missing, but also what's working really well. And so the final recommendations will be coming out in spring 2024, and hoping that will lead to some changes just in how we approach this moving forward. All right. So with that, I'd like to just maybe take a few moments to see if there's any lingering questions about the ARPA projects. I think probably the best way to keep in touch with how things are progressing, stakeholder engagement opportunities for these new grant opportunities, is to bookmark those pages that we've shared with you, the ARPA grants website, signing up for the Constant Contact newsletter, the OCL stakeholder engagement calendar, that's our office's stakeholder engagement calendar. Those are probably the best ways, but I wouldn't mind dropping, you know, that coming to our action group meetings and our collaborative meetings are also a great way to keep informed with that as well. So let me just leave it open for a minute for raised hands or things coming through the chat. If there's nothing, I'll go ahead and move us forward. All right, and I'm hearing nothing, and I hate nothing more than silence for longer than like 30 seconds or so. So we're just gonna go ahead and move. But if questions come up, you can always reach out to our Direct Care Workforce Unit team. We're happy to answer those questions, share resources, and just basically keep you as connected as we can. Before I move forward, I actually see that Oliver has joined us, our new co-chair. Oliver, not to put you on the spot, but would you mind maybe introducing yourself before we move on?
No, not at all. And I apologize for being late. Being this is a direct care workforce group, I'll share this with you, but my caregiver had a small family emergency, so I got up late, an hour later than I intended to. So I apologize, but my name is Oliver Giminero. I'm the new co-chair of the Direct Care Workforce Collaborative. I've lived with a spinal cord injury for 31 years. I have received a variety of different direct care options. When I first got injured, I lived on the western slope of Colorado, a small rural town called Crawford, and my family and friends were my caregivers. Then I moved to Pueblo, Colorado, and I received home health care. And for the last 15 years, I've been self-directing my care through the CDOS program. My background is in mechanical engineering. And I've been a disability advocate for the last 5-6 years. I've really been participating in a lot of different things. I'm currently chair of the Denver Commission for People with Disabilities. I'm also a board member for a nonprofit that provide integrative health, massage, chiropractic, acupuncture to persons with neurological disorders. And I've participated in a bunch of advocacy groups and boards and collaboratives. So I'm happy to be working with you guys, and I look forward to our future meetings.
Perfect. Thank you, Oliver. We're happy you made it. We're happy you were able to attend with us today, and we're really excited to have Oliver on the team as well. If you have questions about self-direction, participant direction, advocacy, he's kind of your go-to for that. So certainly pop in, reach out to him if you have questions, and we look forward to having him for as long as he'll have us. So all right. So with that, I would like to move us into opportunities for direct care workers. Sorry, lost my place there. So this is something we're going to have on the agenda, hopefully every collaborative about 10:45. So if direct care workers, we know they're working during this time, this is a tough time to come to a meeting, certainly an hour and a half long meeting. And so we're going to try to have this at 10:45 every time so they know they can join at this time and learn about bullet points of what's happening in this space for them. So with that, I'd like Heather, if you wouldn't mind talking about the individual grant.
Sure, thank you. I just love giving away money. I say that it's harder than than I thought it would be. One of our other training grant opportunities is for direct care workers for reimbursement up to $500 for any sort of training that again is beyond that basic onboarding that would help them in the direct care field. And so it's a pretty broad category of trainings that can be considered. We've had a lot of folks apply who are RBTs, behavior technicians, looking at some different trainings there. So when I say direct care worker, it's really, I look at it as primarily what you're doing directly with that consumer. And then, if you're in a management position and you're doing that most of the time, you're not a direct care worker for the purpose of this grant. But if you're actually doing the work, you might be able to consider yourself a direct care worker and apply for this grant. It's up to $500, but again, it could be $20, $30 trainings. We know there's a lot out there online that might be convenient for folks to take, and we'd love to be able to help them with that and reimburse after that. There is an option with this grant to have some prepayment assistance. You'll find that on the application. And so if that is something that would assist you with being able to get to the training, we'd like to be able to consider that. The grant also up to that 500 includes transportation reimbursement. I believe it's over 40 miles round trip, and also with training specific course material. So if you need a manual or a certain video, I don't know if people do videos anymore, those can also be considered for this. You can apply for this grant multiple times. You just have to complete the grant. So complete the training, send in the information, and then you can apply for another grant. So this might be something that would work for someone looking at a series of trainings and being able to take them one at a time. Applications are open through November 15th, 2023, or until we run out of money. So it's been open for a month, almost a month, and we've had 37 applicants, and we've been able to award at least half of those applicants with grants. So that's really exciting. And I would love nothing more than to see your application when I open the Smart Sheet tomorrow morning. And if you have questions about this, please drop us a line in our email, and we'd love to be able to answer any questions. We try to feel like it was a pretty easy application. You can include a screenshot or a link to the training. So we're trying to make it as technology friendly for a cell phone as possible. So we'd also welcome any feedback if you run into snags on this application. And just in case there's any questions on the grant.
I don't see any coming through. I did drop the grant link again, and that's the 1.05 individual grant. So that should be the first one you see on that website. And then Kathy's asking for the email, which is just our HICPUF Direct Care Workforce email that's on the screen, but perhaps one of my team members could drop that in the chat as well, to just drag and drop. So, well, since we're a few minutes ahead of schedule, Does anyone on the call have other opportunities that they're aware of for our direct care workers that you'd like to share? We do have the open forum later as well too, but certainly if there's a direct care worker on, we'd like to give you time and space to share some stuff with them. Okay, perfect. Again, can't let it go too long. But if anything comes up, again, raise your hand or drop it in the chat and we can certainly make time for announcements. All right. Next up is instead of doing an action group spotlight, which we typically do where we take one of our action groups and have them share kind of what's happening in this space, all of our action groups are working on the proclamation. And so I'm going to go over just some logistics, and I don't know if some of my co-chairs are here from the leadership team that they perhaps be willing to speak to. So if so, I'm not gonna put you on the spot, but if you would like to speak about the proclamation and the great work that's happening, just raise your hand and I will have you talk. So just logistically, we are having the Direct Care Workforce Collaborative leadership team is doing Direct Care Worker Appreciation Week, April 2nd through the 8th. We've been talking about this what feels like months because we submitted our governor's proclamation, the application for that, in December of 2022. So we really have been talking about it for months. So we started, I think, in October, putting together the language. We officially applied for it in December. And I just received word from a couple different folks that we're looking at either this week or next to actually getting the approval. So we're going to go ahead and go full steam ahead. There's no reason it shouldn't come through. So we are going to go ahead and focus on that planning piece of it. So with that, what we've done for the remainder of the March action group meetings, which is our compensation and benefits and our value and awareness, instead of having two separate meetings on two separate Fridays, we have combined those meetings on March 24th at 1 p.m. And typically those meetings are an hour, but if possible, we have asked for an hour and a half of your time to be able to really work group the proclamation. I foresee maybe having some breakout rooms where folks maybe talk about the messaging and the outreach, who needs to get this information. And then another group is working on activities, events that we want to do and really getting the logistics of putting that together. It is a short timeline. We are working under pressure, but we've just been kind of waiting for that approval to come through. And now that we kind of know that it's happening, I think we can go ahead and move forward. So we're going to use that Friday, March 24th meeting at 1 p.m. To really work group that. If you're on either the compensation and benefits or the value and awareness action group invites, you should have received the combined meeting invite. But if not, please put your email in the chat and just say you'd like an invite to that work group meeting. That can also be your first meeting. If you're just interested in planning for the proclamation, this Direct Care Worker Appreciation Week, if that's something you're interested in, just put your email in and this could be the only meeting you ever attend. That is fine, though we'd love to have you for more. So be on the lookout for updates. We'll certainly send any updates we have to the meeting invite list for this meeting. We'll probably post it to the website as well. Just so we can get this information out. We know that a lot of other agencies do like DSP week in September, and a few other agencies do some other stuff. And we don't want to step on any toes, but we did want to take some time early in the year to get this proclamation through and really do some dedicated time and space for our direct care workers. So let me know. I see a couple emails that I'll put on the list. And if any of our co-chairs would like to speak to this, I'll give you just a few minutes. And I do know that the one, Deborah Lively is our compensation and benefits action group co-chair, and she is actually in DC this week and not able to join us today. So she's the one I would nab to give an update more than just the logistics for me. So if you have ideas for what the proclamation should include, then certainly send those to the Direct Care Workforce Collaborative email or join that meeting on the 24th. And Hope, one of our co-chairs, this initiative is also intended to be an annual event. So something that this leadership team has decided is important, wants to continue, and we're really going to be looking at sustainability of this for years to come.
Yes, and this is Pascal Brooke, and I just want to invite every organization that works with direct care workers. This is the week, right? We've been waiting for that. We've been waiting for the recognition. We want to value them. This is a week where we're going to we're gonna just highlight the work of a director workforce, and also, talk about how agencies can work together with them to make it better, right, in a daily living. So it's very important to us. We work hard to get this proclamation week happen. Please join, and we'll be happy to have you. Thank you so much.
Thank you, Pascal. And he'll put another update in. I have the dates wrong, apparently, like April 2nd through the 6th instead of the 2nd through the 8th. So just an error on the slide there. So yeah, certainly we'll be pushing out lots of information. Our Direct Care Workforce Collaborative leadership team has been working tirelessly on this in addition to their other duties and their other jobs. I mean, they are just volunteers for this. So we're so appreciative of it. We're really hoping to raise some awareness, add some value, shed some light. And so any way you can help us celebrate our direct care workers, we would love to hear from you. So I think, again, we're running ahead of schedule, but I think that's okay. So I'm going to go ahead and move us into our open forum. And we have a very special, I'm hoping she's here. Let me look. Yes, we do. Okay, I'm going to hand this over. We're going to have some time after this presenter to do open forum, but I pegged Jen Oakes here to share a little bit about what she's up to. She's got some exciting news and some exciting stuff going on in this space. So Jen, if you're ready, I will go to your first slide.
Yeah, Brooke, thank you. So, yeah, I am Miss Wheelchair Colorado for 2023. So that will be a great way for us to advocate for everything. Right now, of course, I'm working with Colorado Care Workers Unite to support them with which is very much what we're trying to do with the Action and Value National Awareness Group, because we need to give caregivers what they deserve. Next slide. So in late August, I will go to Grand Rapids, Michigan to compete in a week-long competition for Miss Wheelchair America. And this is not a beauty pageant, it's based on advocacy. So I have to show what I've done advocacy was, do a speech, do an essay, blah, blah, blah. But again, a great way to advocate for Colorado and disability rights. Next slide. Yeah, this explains about me, what I've been doing, how I got here, and all I'm involved with. I was diagnosed with leukemia, and an adverse reaction to chemotherapy made me a wheelchair user. So, and I've lived in a nursing home and independently. So I definitely have both perspectives with it, because this is all just crap. You can read that if you want. Next slide.
We like to know about you, Jen.
So really, my platform will be independent living, but to have independent living, we need to fix this caregiver crisis. So those two go hand in hand. So I mean, obviously I want to promote independent living, but I will not do that if we cannot ensure that people can get quality caregivers in their home, which is really important. Because I mean, last summer my caregiver fell ill, and I went without care for a month because there was no one to replace her. So this is a big deal. We need to work with that. And that just explains, like right now I have a caregiver who visits me 5 days a week, but she only, like Monday is the longest she stays with me for 3 hours. The rest of the week is basically just laundry and checking up on stuff. So I mean, it's not like every day, all day, but I do need help. And without these caregivers, I could not live independently, which I feel like so many people benefit for living independently versus living in a nursing home or institution.
There we go. So open forum. I do think I pegged someone else to do another announcement too, and then we'll open it up. Alejo, are you here to give an update on the Bill of Rights?
Yes. So basically, Jen being one of our strong advocates as well at the Capitol, going around and fighting for, addressing this care worker shortage. Care workers have been coming together since last summer with the Home Care Bill of Rights, which is essentially establishing that the needs for home care are 5 planks, and one of them being decision-making power. And that's something that care workers really value, and that's really having a say over their own working conditions. So workers being able to advocate for what they want to see change in their industry. So we've been in partnership and collaboration with legislators, and we, thanks Pascal, and we are here soon going to be unveiling the Home Care Workforce Stabilization Act, which is going to be a table where care workers, consumers, and disability advocates and employers can sit together and create recommendations to the legislature on things that need to change. This is a really exciting thing, and it's been something that disability advocates and care workers have been going to the Capitol every week for the past couple of months to really make sure it happens. So I know some folks in here have been a part of that. So thank you so much for helping get this done. And we will definitely have more information about that in the next week or two as we're finishing up drafting. So super, super excited about it. Yes, Ashley, we are working with Rep Ortiz, and we do have several other sponsors. I believe he might be one of the sponsors. I'm not super sure, but I know he's been involved and included.
Awesome. Thank you so much. And if you wouldn't mind, maybe just dropping a couple links, you or Pascal, just somewhere folks can go to learn more about it if you have a website or something like that. And we'll certainly have continued updates from this group as well as we kind of move through this. And we work really closely with the advocacy organizations and would really like to hear updates because this is an important piece that they're pushing forward for us. So I see some hands up. So let's go to the rest of the open forum. Kathy, please.
Yeah, I just wanted to say this has been very exciting. I was a CNA 20 years ago for 10 years, and then I have MS, and now I had a stroke. So I now need caregivers. So I'm living with a disability. I'm not quite a senior yet, but I'm just a couple of years away from that. And I find this all very exciting. And when I was in Centennial after my stroke, I was helping train CNAs in how to care for people with disabilities. So, I mean, this is all just right in my wheelhouse, I guess you say. I'm not the most up to date on lingo and everything, but I do find this very exciting. It was going so fast, I couldn't write everything down, but I know several CNAs, plus my mother-in-law lives near Fort Garland in a little town called Antonito, and she has caregivers that come to take care of her and home health aides. And so I wanted to share this with her so she could share it with her caregivers because, like I said, they're very rural. And it's just, and my daughter-in-law is looking for training opportunities. I mean, she's staying with me right now, but normally her and my son live in their own apartment, but they're here today. And so I shared with her the link for the training, the grant. So hopefully she will apply for and be able to get the grant to help further her education. She's CNA and a MA, and she's been going to nursing school. So she's working her way, up. And I'm close with a lot of people in the medical field, and I advocate for myself constantly. I just finally, a year and a half out from my stroke, just got word today that they're finally going to give me a hospital bed. So that's going to help. And a lift, which is going to help my husband more than me, but still, it's a battle. Everything's a battle. And getting caregivers. Pikes Peak Area Agency has a program where they give vouchers. And luckily, I've been able to get a voucher to cover some of my aides, but other than that, they're private pay. Because I don't qualify for Medicaid. So that's enough of me talking, but I just want to share that. And it's all very exciting to me. And I might want to compete for that Miss Wheelchair thing, because I've been in a wheelchair for about 4 years now.
Well, it sounds like we've really checked some boxes, and you bring a good perspective, Kathy. How did you hear about us? Can I ask you?
Karen Brown and I are on, I'm on the state, what is it, CC? I never can get the initials right.
Oh yeah, the Commission on Aging?
Yeah, the Commission on Aging. Yes, I'm on that. I represent District 5, which is El Paso County. And I've been trying to include my mother-in-law as much as possible, because she's a former hippie, so she knows all about protesting and stuff. So.
Okay. Well, perfect. We're so happy to have you, Kathy. Thank you so much.
Oh, you're more than welcome. And like I said, I'm very excited about all this. It's just the information was flying so fast. I'm trying to take screenshots of the slides.
I know. It's a lot.
It's like,
it's
oh
a
my
lot.
God. This is all
we'll connect with you. We'll connect with you and make sure you caught everything. And like I said, the recording will be posted too, so you can watch it as much as you want.
Oh, that'd be awesome. Because I'll just write out a transcript. I'm very paper and pen oriented. I'm old school. So
yes, yeah.
But I like to share with people that are a little less old school than me.
Yes. Well, thank you, Kathy. Let me get, we got a few other hands raised. Let me get to Allison.
Hi again. Just really quick, I just wanted to let you all know that I'm going to drop my email in the chat. We have a lot of upcoming trainings for the secondary trauma resiliency training. We offer both online, so people that are not close to our area or in other states have that option to join our online. We also have the in-person training. And if everybody would like, please feel free to email me. I have a lot of resources, digital brochures that I can offer, and information about Vital Hearts. So just reach out to me and I'll be happy to give you some more information about all our upcoming, trainings. Okay.
That sounds good, Allison. Thank you so much. We're so happy to have you. Yeah.
Yes. And this has been great. It's such great information. I'm really happy to be here. Thank you for the invite.
Thank you. Yes, you bet. Jen, please.
I just want to say, Kathy, contact me. I am looking for future people who want to be in this wheelchair, because I'll be, I only do it for a year, so I'm going to put my email in the chat.
Perfect. Thank you, Jen. Out here recruiting. We love it.
Yep.
And we still have some time for some additional open forums. So if you have thoughts, questions, raise your hand, drop it in the chat, unmute. We'd love to hear from you. All right. Well, I'm going to go ahead and take us forward just because, we get done a little early. That's okay, because we're always here for questions, to share resources. I know I'll see most of you again soon. So happy to just kind of move us through the rest of our slides and see where we end up. So we've shared many of these resources throughout the chat, but we just want to give specific call outs to that ARPA grants website. That's where you can find all of the open grant solicitations, including the 1.05 provider and individual grants that we talked about today. You can find application information, the RFAs, ineligible cost list. I mean, everything that we have, you can find on there. Past recordings of informational webinars. For the provider grant, we actually have like a walk through the application, how to walk through it. And so just kind of bookmark that and keep that handy for you. We do have our HCPF surveys website as well. This one we may not have dropped in the chat, but some of this just lists all of the open surveys that HCPF has going on right now. With the ARPA money, we know there's a ton of surveys, a ton of stuff coming at you, and this is just a place to kind of go and get your bearings straight and say, this is what's open, this is what's closed, and this is when we can expect it again. Our Direct Care Workforce Collaborative website, is probably the best website on this list. Just saying, you can get a ton of great information on there. All information about our action groups, information about upcoming meetings, past meetings. We really try to keep that up to date for you to bookmark, to keep informed on all things in this space. And then the last one I want to share is our story sharing blog. And I know I mentioned it a little bit before. This is something that Jen and our Value and Awareness Action Group really helped us stand up. Jen is currently monitoring it, and we would love to have more stories being shared. And so this is a space for direct care workers, family members, individuals receiving services, to go and read other stories and also submit your own stories about the things that you enjoy, the things that are tough, and just kind of like tell about all the different ways that direct care workers are holding up the economy and taking care of folks and really ensuring that folks can stay in their communities and live independently. And so there's a ton of, well, I don't want to say a ton, there's a handful of stories on there already. We'd love to get more. We're really going to lean into this for the proclamation and the Direct Care Worker Appreciation Week, because we think it's valuable in showing all the different ways that direct care workers are out there supporting folks and really just taking care of those that need it most. So I think Sam dropped the link of the blog on there, so check it out. And then also on that website is the dcwstorysharing@gmail.com, where you could submit your own story. So we would love that. All right. So with that, we are at 11:15, so we'll get done a little bit early today, but I'm just going to take us through our closing with a few reminders. The next Direct Care Workforce Collaborative meeting will be in June. Seems like forever away, but I promise we'll be there quicker than we think. It'll take place at the same time, 10 o'clock to 11:30 is what we bank on usually. Some are really full, some get done a few minutes early like this one did today, but put that on your calendar. It'll be the same Zoom join information. We use the same room for this. So if for some reason you lose that, you can always go back to this and join this same Zoom room. If you have questions, of course, there's our email, and we try to put the tentative agenda on the website about 7 to 10 days before the meeting. So you can always go and take a peek at that and kind of plan your time accordingly. We really try to stick to the schedule so folks can join when their schedule allows, and then they'll always be recorded and posted on the website as well. We do have a survey that I'd like you to please take for us. This helps inform future collaborative meetings. I'm the person that gets these. I'm the person that's reading them. And so if you say something for future meetings that makes sense, that's how we got the open forum on this. A participant directed meeting that we have in the department does an open forum platform, and people really like that. They like the ability and the space to take that time to speak and share resources. So that's something we implemented because of the survey. And so yeah, so we would love to hear your feedback. The survey link should be dropped in just so soon here. It's a Google form. It should take you just a few minutes. In fact, if you want to take these last few minutes before 11:30 to do it, I would love that so much. And we just really want to say thank you for joining us today, getting these updates and taking the time to spend some time with us. So with that, I just want to say thank you. Are there any parting thoughts, anything we missed? All right. Well, take care, everyone. I hope you get some sunshine soon. And yeah, we will see you next time. Thank you so much.